Chat. Long time no see. Pinabasa kita eh.
Our colleagues in public service, welcome back to the virtual plenary room. We will now be listening to our last, but certainly not the least, speaker. To formally introduce our final plenary speaker for today, here is UP Padayon Director, Dr. Jeanette Eliasol Naval.
Good afternoon once again. We are so lucky to have with us this afternoon for our last but not the least, of course, plenary lecture, the incumbent local chief executive, the mayor of the city of Marikina. He is the key figure in the implementation of crucial COVID management initiatives and in building resiliency among the residents and communities of Marikina. Public service during the time of COVID, for sure, has demanded a more sweeping response than even the worst flood that has hit the city. I know we are all eager to hear and learn about the city's experience in dealing with the pandemic and the challenges it had to go through in the delivery of public service in this time of crisis. Our speaker is no stranger to UP and the academe. He hails from a long line of public school teachers, which must have instilled his love for education. He is our very own alumnus. He finished his Bachelor of Arts in Philosophy cum laude from the University of the Philippines, Diliman, where he also taught logic and social political philosophy in the 1990s. He further pursued MA in Teaching Philosophy at the Ateneo de Manila University. As a member of the House of Representatives from 2007 to 2016, he initiated and pushed for the passage of several education bills, such as the Kindergarten Act, Ladderized Education Act, the Unified Student Financial Assistance System for Tertiary Education Act, the UP Charter Act, and the Philippine Normal University Modernization Act. He also initiated the libreng pag-aaral sa pagdudoktor para sa mga Marikenyo program. Some of his prominent COVID-related initiatives include the establishment of the Marikina Molecular Diagnostics Laboratory early on in the pandemic, and other vital COVID-19 quarantine and treatment facilities in his own local government unit. Colleagues, friends in public service, our plenary speaker, Honorable Marcelino Marcy Chodoro.
Magandang araw po sa ating lahat and to all the participants in this plenary conference. Agent, long time no see. Maraming salamat. Basically, our COVID response in Marikina is based on the principle of institutionalized competence. This is our basic governance principle and the community values that we would like to present. that everyone is a stakeholder and no one is above anybody. We follow a whole of institution approach where the entire local government is involved and equipped with the appropriate knowledge and skills necessary to fulfill their various roles in our COVID-19 response. Parang sinasabi namin dito, bawat isa ay may bahagi. Pinakamaliit mang kawani ng ating pamahalaan ay may papel na ginagampanan. Natatandaan ko na nag-aaral ako, nabasa ko yung theory ni Nozick on organizational competency. That for an organization to be effective, efficient, every individual in the organization should know his role in the organization. Not only is a small part, but the purpose of the as a whole. Ito yung pinipilit namin gawin, pinakaunawa namin buhat sa pinakamataas na kawani at sa pinakamaliit na kawani. Na kami sa bawat isa ay may bahagi. The Marikina IATF or the Marikina Interagency Task Force is composed of 8 response teams that streamline and delineate our interconnected services. Basically, we simply follow the guidelines provided by the World Health Organization with respect to COVID response. What is tested and what is tried on the global stage, we simply apply it at the local scene. Our response basically can be characterized both as aggressive and logical. Our response is guided by science and common sense. We value data-driven situation analysis and decision making. Looking into data and feedback to form our strategies and policies. The data that we gather is from the community, not from books, not from any studies, but the data that we gather basically emanate from what we hear from the people that we encounter on the ground. Kung ano yung sinasabi nila, kung ano yung nararamdaman nila, kung ano yung story. So it will start from anecdotal stories, but later on, we'll try to gather, to get the data that we could analyze both quantitatively and qualitatively. We especially value data derived from our constant feedback and dialogue with the people. Response must also be timely, na papanahon, and within their period of necessity. Doon sa panahon na may pangangailangan ng tao. I think most of the government failed on this aspect to respond timely and to respond based on what is necessary. Ganun kasimple. So we simply practice the sense of the people, and that is common sense. So what we have is a common sense government. We are fortunate in Marikina that the culture of discipline is established already long time before the pandemic. Yung disiplina is part of the everyday taga Marikina's way of life. As we know, discipline comes from the word discere, meaning to learn, natututo, na pinag-aaralan. And this definition best describes the kind of discipline that we have cultivated here in the city, in Marikina. It is discipline as a learned response. The people are disciplined not out of fear, dahil may parusa o may penalty. Our people are disciplined primarily because they know what they should follow, and they understand that it is for their own good and the communities as a whole. Discipline for Marikina as a utility uh, we exercise what we call utilitarian perspective in discipline, that we benefit in our practice of discipline as an individual and as a community. The local government and the people are hand in hand in our COVID-19 response. We also follow not only the whole of institution approach, but more importantly, the whole of society approach, wherein every sector and each member are involved in every step. Communication, as we know, is not a one way traffic, but rather people take part from development to implementation and monitoring and evaluation through sectoral dialogues and citizen feedback. We also encourage initiatives to be taken at all levels, from the individual to the community. Uh, this pandemic basically is a new experience for all of us. It is a time-sensitive problem, and knowledge on COVID is constantly changing. So prompt adaptation is necessary. It's imperative. Therefore, our response must be dynamic, recalibrating, replanning, and creating flexible policies, work systems, and protocols is a must to consistently address issues using updated and appropriate strategies. Uh, I've been trying to read on some of the literatures presented in the plenary, and natutuwa ako, ang dami na palang literature. But I must admit, I haven't read anything prior to this session. Our strategy is basically the strategy being adopted by the Department of Health in preventing COVID. This is the PDITR, the prevent, detect, isolate, treat, and integrate. We simply copy what is provided for by the Department of Health on how to best address COVID-19 in the community. Prevent as we implement strict health protocols in adherence to minimum public health standards. For example, wearing of face masks, practicing physical or social distancing, disinfection, implementing lockdowns and others. Detect is we conduct aggressive contact tracing and expanded community testing or surveillance testing that is independent, efficient, and democratized. As early as February of 2020, the World Health Organization has identified testing, isolation, and contact tracing as the backbone of any COVID-19 response. And Marikina is no different to this strategy. By March of 2020, when the Philippines had less than 10 confirmed cases, we already started planning our own molecular diagnostic laboratory. Simple lang, yun yung sinasabi. Kailangan makapag-test. We need to test in order to determine the medical support that we need to provide to a COVID patient. We need to test in order to undertake an efficient containment measure. So yun yung inisip namin, magtayo ng isang diagnostic laboratory. Aside from being the logical response from expert recommendations, we also simply follow the sense of the people, and that is common sense. It was imperative, thus we acted with urgency. We encountered regulatory deterrents, but we were resolute and we pursued. We had no hidden agenda or motives. Our main priority was clear from the beginning: an independent testing facility, ensuring democratized access for all Marikina residents to testing. From a network of access points where they can request to be tested, sa mga barangay, sa mga homeowners association, sa lahat. uh, to an efficient testing facility, to our own diagnostic laboratory, we strive to ensure accessibility at all stages for the entire population of the city, and as an extension to our neighboring areas as well. The establishment of our molecular diagnostic laboratory was, was made possible through the expertise of existing health service centers. The Manila Health Tech Incorporated, for example, located here in Marikina, extended their support and assistance by providing training to our molecular laboratory personnel. Our staff were also trained at the Philippine Genome Center and the RITM, or the Research Institute for Tropical Medicine. And that is basically what provided the, the bedrock or the backbone of our testing facility. Isolate. We have built and temporarily converted existing structures to serve our isolation facilities. One example is our Marikina Hotel. Through a partnership with the Department of Public Works and Highways, we also have a quarantine facility where the container vans converted to isolation rooms. With regards to treatment, for severe cases, our case officers help from hospital referral to the transfer of the patient to health facility. For mild cases, we assist through provision of equipment, for example, oxygen tank, medicine, as well as telehealth services. On reintegration, our efficient system enables us to provide immediate results so that recovered individuals may resume their economic and non-economic activities as soon as possible. While they were unable to, we also provide food packs and assistance for them and their families. Ito mga strategy na to ay hindi naman naiba sa ibang LGU. We simply foresee this strategy with urgency, and as I have said earlier, with common sense. With regards to our vaccination program, we have two ways to register. First is an online registration system through our Marikina website. This was developed by our Management Information Systems and Call Center Office. This week, we have also launched our online registration for minors in preparation for the pediatric vaccination rollout, which commenced this morning. Despite having this online system, we do recognize that not everyone has internet access, or others may find it difficult to navigate. So we also have our barangay or community registrations. Through our barangay and community leaders, citizens are also able to manually sign up. Once registered, we inform them of their schedules through stubs and letters, which we deliver to their homes. We also notify them through text messages and calls. There's redundancy on that. This is a laborious process, but we also value the connection that it creates. If they have hesitancies, our concerns prior to getting vaccinated, our callers are able to address them immediately through this process. Our vaccination is a simple process. It's a 3-step process, which on average takes around 20 to 45 minutes. From registration, where they also undergo medical screening, to the vaccination, then lastly, observation. Currently, we have 6 mega vaccination facilities, 75 vaccination teams, and we are able to inoculate up to 15,000 individuals a day. We temporarily converted our Marikina Sports Center and Marikina Convention Center as mega vaccination facilities. We also have 4 public schools as mega vaccination facilities. All of these sites are at most 2 kilometers away from a hospital and our storage facility, vaccine storage facility. The proximity is within a 2-kilometer radius. There is no clear and exact science to our COVID response. We must admit that. This is developing, or rather, this is a fusion of expert analysis and contingencies of unfolding events. But just as we have learned to adapt and be ingenious in our response to the pandemic, we must move forward with the same mindset. Everything that we have experienced for the past year and a half must be put to use, not only for future crisis, but most especially in planning and prevention efforts, and in crafting better policies and programs for a better quality of life for all, for a more resilient and sustainable government and the city, or NCT. New and proper social infrastructures. This pandemic has also drawn our attention to what we can still improve. What we can still improve to meet the needs of a healthy and happy population. It is evident that investing more in building and operationalizing facilities and services that cater to the health and wellness of our people is critical moving forward. We have long started by building satellite social welfare offices and health centers, enhancing our public spaces such as parks, sports facilities, and open spaces for recreation and community activities. And we have boosted our public safety and security through our Office of the Public Safety and Security and our Emergency Rescue 161, among others. While improving our social infrastructures has always been a priority, because of this pandemic, we now have a better grasp of its extent and urgency. All the challenges that came with the pandemic and how we handled it as a community, as a city, has strengthened our belief that the involvement of our citizens, both as individuals and as communities, is fundamental to our survival and success. Community engagement is of paramount importance. Citizens should be given opportunities to be heard, to act, and to collaborate. This pandemic redefined the socio-political landscape, redefined established relationships and institutions. Even government mandate is evolving based on necessity. Now more than ever, it has been made clear that the government and the people are fellow stakeholders. We are co-equals. An involved community and a listening government must work hand in hand. We should listen to the people. They understand our problems the most. They have their own stories, and I think we in government should be able to listen genuinely to what the people will say, what they feel, what they need. It is with certainty that they know the solutions, and more than anyone, they know what's important. Maraming salamat po.
Thank you very much, Mayor Marcy. So, para po sa ating mga attendees, magpalakpak na lang po tayo sa ating mga tapat ng screens ngayon. Okay? Kasi po, we have heard insights from Mayor Marcy regarding the experience of the pandemic response in Marikina City. And as we have seen, magaling po. Uunahan ko na lang din, no? Ang gusto ko pong sabihin ay nagustuhan ko yung sinabi niyo, Mayor Marcy, kasi nabanggit niyo kanina na immediate pandemic response should be adaptive. Unang-una sa lahat kasi this is an unprecedented situation. Wala sa ating may alam kung ano dapat gawin, unang gagawin. Walang guidebook ang COVID-19 pandemic. We may have encountered disasters and other epidemics in the past, but this is really one of a kind, one for the books. And as we have seen in your efforts in Marikina City, you have brought everyone around the table. Nakita po natin sa mga nanonood po sa atin ngayon, nakita natin yung task force na binuo ni Mayor Marcy noong mga unang araw ng pandemic. Actually po, sa mga napanood at napakinggan namin sa 2 araw na CUPSCon 4, maraming mga interventions ang ganito din ang approach. Adaptive din at merong sense of urgency. Simply because what we have in mind is the continuity of our services, unhampered delivery of our services sa mga pinagsisilbihan natin. Salamat po, Mayor Marcy. Okay, so I will just check our chat box and our question and answer Zoom feature. May mga nagbibigay ng clapping emoji dito. I think they are just overwhelmed with everything that you have presented, Mayor. Hindi naman kaila sa lahat na lalo na ang Marikina Molecular Diagnostic Laboratory, isa yan sa mga pinaka nakakabilib na pandemic response, lalo na sa side ng mga LGUs. Sir, actually many of our conference participants come from higher education institutions, and the initiatives that they have presented are mostly collaborative in nature. Meron ba kayong masasabi sa kanila about existing academe, local government partnerships na meron ang Marikina City at siguro some inspiration for them to continue collaborating with local governments?
Yes, as I have earlier, I never thought that there are many literature now written about the pandemic response. I think all of this paper can be provided. Even a copy of this paper will help us to navigate on this uncharted territory that we are presently treading. Lalo na sa iniisip natin pagbubukas sa face-to-face classes, limited face-to-face classes. I believe that we cannot survive on a digital platform in teaching and in imparting of knowledge. Interaction is very important. Even bits of ideas, or even small idea coming from anybody could help us not only to provide what we call the statutory framework for many aspects of governance and the services that we provide to the community. This pandemic taught us to be collaborative, maging participative lahat. But no one has a monopoly of ideas or expertise. This pandemic proved that everybody is an expert. Miski yung ordinaryong tao na nasa labas ng lansangan, alam nila kung ano yung kailangan. As I have been telling our officials, not only in the city, but during our meetings with some representatives of IATF, I think we should have a listening government. Whatever definition we have of a listening government, the idea is really that we should be able to have a government that listens, a government that is yung gobyerno na yung tao talaga. Pati yung mga batas natin, would you believe that we have a national law stating that or prohibiting anybody to operate a diagnostic molecular laboratory without the necessary accreditation from the DOH. And that's the reason why we cannot establish our molecular diagnostic at the outset of the pandemic. But I'm saying then to DOH that we should act with urgency. Dahil we're in a pandemic. The scale is not that we have not yet experienced. Hindi pa natin nararanasan. Ngayon pa lang, it's on a global magnitude. Kaya sabi ko, we should be able not only to adapt, but to be creative in so many ways, to be innovative in so many ways. Even in our thinking, this is a paradigm shift for everybody. Pragmatism is very important. Maging pragmatic tayo. Malaman mo na meron kang malalaman sa ibang tao. Wala ka na monopoly na. It redefine pati nito yung center of power. Hindi na from the center, nag-shift na. It's yung authority ngayon comes from all points, Sana alam pa natin daw nasa akad pag sinasabi ko ito. Yun ang problema. Marami dun sa mga IATF regulations, rules natin, nagagaling dun sa center. Kaya mali yung interpretation at impractical to implement it. It cannot be implemented. Hindi nang galing sa tao, hindi nang galing sa karanasan. It should be experiential. Ito, yung mga ganito, I mean, ang importante is a framework, a framework and a perspective that you could provide to us as local chief executive. Sir Wendell, hello po. Nakita yung comment ni Sir Wendell.
Yes po, opo. Actually, I totally agree na you said all the right words na dapat yung pandemic response natin is very responsive at walang ibang paraan para maging responsive ang pandemic initiatives natin kung hindi ito magagaling sa hindi ito cognizant sa mga totoong pangangailangan ng mga nasasakupan nyo. Okay, so meron po tayong question from Professor Aurelio Vilbar from UP Cebu. Mayor, are there plans of your schools to do some face-to-face teaching soon?
Yes, sir. We intend to do that. In order to close the gap. May gap ngayon yung learning process ng bata. Yung interaction with a person is very important. We learn from interaction. That's the reason why we are aggressively undertaking the pediatric vaccination, and we're looking at it not only from the point of view of health, pero from the sociological point of view, that we need to undertake vaccination in order to achieve what we call herd immunity in our school population. Kaya ang ginagawa naming approach dito sa Marikina ngayon, we pre-register vaccinees through the schools. We're using the organizational, the organization of school, the school organization. Yung year level, section, yung teacher, may natural organization sila. A big practical about it. Hindi ko idea ng mga tao to. Sabi nila, siguro may pinakamagaling para makapagpabakuna lahat. Halos lahat ng kabataan nasa eskwela, nag-aaral. So kinausap namin yung mga teachers, yung principals, kinuha namin yung class record nila. Of course, may paalam with considering yung data privacy. Yun, tapos doon namin kinausap through yung mga integration process. May mga ganun process like DepEd. They integrate the lesson of vaccination dun sa classroom instruction. So yung vaccine hesitancy, wala na rin in the process. Tapos kung may queries, may clarifications, nagagawa between the student and the teachers, nakakapagpaliwanag. And nasurpresa ako nung makita ko yung mga discussion ng mga grade 8, grade 9, at grade 11 ng mga estudyante, ano, na yung know-how nila on what's happening. Because siguro, marahil na rin doon sa access to the technology, na-redefine na rin na-redefine na rin yung technology. Unlike before, walang internet, walang Google Drive. Ngayon, hindi. Pag meron kayo isang word na hindi maintindihan, simple yan. Unlike before, punta ka pa ng library, maghihiram may library card ka, maghihiram ka pa ng libro. Hahanapin mo, paghihiramin mo ng libro, wala pa. Hindi mo malaman kung ano ibig sabihin. When you say, search halimbawa, yung word na utilitarian, ilalabas na sa ano, may when you look for a certain author or a paper na gusto mo basta, lalabas na. I think it has democratized not only our access but yung practice. So, yun po yung sagot ko. To put it simply, yes, may plano po. Kaya gusto ko na makapagpakuna na mabilis at ma-achieve yung herd immunity. Pag na-achieve yung herd immunity, I think that will be that's our initial step for a face-to-face access.
Okay, thank you po, Mayor Marcy. Actually, yung iba nating mga presenters na gustong-gusto na rin sana makipag-interact with students, lalo na yung mga educators natin. I think you could also watch your LGUs kung anong mga inihahanda nilang mga initiatives para sa vaccination ng ating mga kabataan. Okay, so yes po, Mayor.
That's what the LGU can do. Pero yung pedagogical requirement, yung pagtuturo, curriculum, I think DepEd should address that.
Yes,
and higher education.
Yes.
Stakehold tayo lahat during the last presentation of the Department of Education with the mayors, particularly in Metro Manila. We're asking for the framework and from the long-term plan. So we could help vaccination. Secondly, we could provide siguro the necessary yung environment, safe environment, yung mga engineering and administrative controls that we need to undertake for the schools. I was even talking to some of the congressmen during the budget hearing from the point of view of a mayor, Capo. Even dapat yung kanilang budget i-realign na dahil we have a new normal ibig sabihin we need a bigger space for school, for classroom. Meron na tayo dapat yung mga health declaration, yung mga disinfection facility, yung mga hand washing facilities sa mga eskwelahan. Unfortunately, when you look into the budget of the Department of Education, what is being deliberated now in Congress, wala pa to yung mga facilities na ito. So, paano tayo magiging handa for a safe environment when we go back to school for a face-to-face classes? I think yung premise na natin gusto to point out kailangan medyo forward-looking, moving not only in planning but in our action.
Yes, sir. Actually, related dun sa sinasabi nyo ngayon, there's a question in our Q&A from Vice Chancellor for Community Affairs of UP Diliman, Dr. Aleli Bawagan. How do you deal with various tensions and differences with national government agencies?
I think it's natural. It's ordinary. May push and pull talaga in governance. And we must admit that it's a reality in governance na may push and pull. Kaming mga nasa local government, we tend to listen to what we hear and what we experience dun sa ground. Sa sinasabi ng ordinaryong tao. Of course, yun sa national, tinitingnan nila more on sa data, statistics, yung statutory framework na ginagamit nila. I think yun yung gap eh. Meron silang mga guidelines na silang nakaset, meron na silang mga manuals of operations for government na dapat na ano. And I think Congress has a role on this matter para yung gap na yon i-close nila. Kasi yung national, meron silang manual of operations na sinusunod na naka-establish na through decrees, through promulgations. Kami naman sa loob, kung ano yung marinig namin sa tao, ano yung sinasabi nilang kailangan nila, then yun yung sinusundan namin. So, yung gap talaga. I think yung academang pag-provide ng to minimize the gap, to provide us with a framework, with the analysis. Ang problema kasi sa mga mayors katulad ko ngayon, siyempre, minsan, wala na kaming framework na ginagamit. Wala na kami yung theory namin, hindi na namin maintindihan din. Pinanggagalingan namin yung perspective namin. I don't know kung nasagot ko yung tanong. That's how I understand.
Okay po. Thank you for that, Mayor Marcy. Dito naman po sa chat natin, I think we have participants, attendees of our webinar ngayon na proud Mariqueños daw. So I think kudos to you for your leadership, for your resolute leadership then, because people are very appreciative, very grateful for the things that you do as the chief executive of Marikina City. There's one last question in our Q&A ngayon related sa mga services na pwede nyo sigurong masagot. Mayor Marcy, pwede ba mag-walk-in sa inyong vaccine or COVID testing facility po kahit outside Marikina?
Nag-ano po kami, nagbabakuna kami non-residents because we realized that we need to vaccinate as one. The safety of one is the safety of everybody. Yung principle natin, and we cannot afford to be selfish on it. Parang papakunahan mo lang we want to create the vaccine bubble as we vaccinate. Pakiusap lang namin para may order. Pwede naman mag-register yung mga non-Marikina resident dun sa portal ng Marikina. Then, meron kaming allocated na isa o dalawang araw for non-Marikina residents. Meron yan mga iba, taga Polo, taga Rizal, minsan taga Cavite, meron nagpapapakuna sa amin, taga Cavite. Tumutulong kami sa effort ng national na makapagpakuna na marami. Because yung national target natin, I think is 91 million. So we're gonna, sa Marikina naman, 15,000 kami ng bakuna. Considering na almost 80% na ng aming population na bakunahan na. Tapos yung natitirang 20%, halos ito na yung minors namin kasi nasimulan namin. Nakapagbakuna na rin kami almost 90,000 ng non-Marikina residents. Then, isang feature sa vaccination namin, marami kaming volunteers sa vaccination site natin. Volunteers, mga doktor, mga nurses, mga vaccinators, because they want to pay it forward. Yung tulong na nagawa sa kanila ng city, they want to pay it forward. At pinapaliwanag ko sa kanila, kung ano man yung nangyayari sa city, ano yan, parang the government, hindi ko matandaan. But we have this principle that the city is our parent, the government uh, is like a parent to us, parang that takes care of us, who takes care of us. Ganon. Kaya ganon. So, nagpapakuna po kami. Yun nga lang, pre-register anybody. Pero mabilis naman, within a week na. Mapapansin din natin ng mga taga-Marikina rito, ah, wala kang makikita pangalan ng mayor. Wala kang wala. Any billboard. Wala kang picture na makikita ng mayor dito eh. So, at tingin ko, so lahat may stake holding, lahat bahagi. Yun ang sinasabi ko sa kanila. Kung ang nangyayari sa sulat ay lahat tayo ay bahagi nito. At dahil sa bawat isa sa atin. Hindi ginawa ng mayor. Walang mayor dito. We simply laid out the direction that where we need to go into or to pursue. Tulad nung na-experience namin yung Ulysses last year, it's a very difficult situation. Pero the first word that I remember na sinabi ko, walang gobyerno ngayon, tayo lahat sama-sama magtutulong-tulong. So, kailangan natin tulungan yung gobyerno, tulungan ng isa't isa. So, nakita ko yung bayanihan talaga. That Filipinos are naturally resilient by nature. Yung resiliency na hindi ka malakas dahil nag-iisa ka, hindi malakas kasi may kasama. I think that's the very definition of it, yung resiliency. That we are a community, people coming together as one, in unison.
Napakaganda po nung last point nyo, Mayor Marcy, na ang resiliency, ang ibig sabihin nito, malakas ka dahil may kasama ka. We will bear that in mind kasi sa 2-day conference na po ito, nakita natin na yung mga presenters natin, yung mga experiences nila, yung mga pandemic response initiatives nila, ganun din ang nasa isipan nila. Hindi sila nakakaangat bilang implementer ng mga initiatives na ito, bagkus ay kasama nila yung mga komunidad, yung mga different publics na at saka mga beneficiaries ng kanilang mga programa. Ngayon po, we will take this time to present the Certificate of Appreciation to Mayor Marcy. So, sa atin pong pagko-close ng CUPSCon. Okay? Basahin ko lamang po ang citation. The UP Padayon Public Service Office, Office of the Vice President for Public Affairs, University of the Philippines, awards the Certificate of Appreciation to Honorable Marcelino R. Teodoro, Plenary Speaker, for sharing his phenomenal experience in implementing crucial COVID-19 management initiatives that helped address the challenges of the pandemic and inspiring the delivery of selfless public service in local government units. Given this 22nd day of October 2021, during the 4th Colleges and Universities Public Service Conference or CUPSCon 4. Signed, Dr. Elena E. Pernia, Vice President for Public Affairs of the University of the Philippines, and Dr. Jeanette Eliasol Naval, Director of the UP Padayon Public Service Office. Maraming salamat po, Mayor Marcy.
Salamat, Charles. Maraming salamat po sa lahat.
Maraming salamat po.
That's it, everyone. Our time may be short, but we have had a very enlightening and meaningful conversation in our final plenary session and open forum today. The 4th Colleges and Universities Public Service Conference, in its first virtual installment, is now coming to a close. It has brought together more than 600 participants from different organizations and academic institutions and featured a total of 104 papers focusing on various aspects of pandemic response made by higher education institutions in collaboration with their partners. Truly, the first virtual CUPSCon is a success. Before we formally close the CUPSCon, here are some reminders. Recordings of conference activities will be distributed upon request after the conference. Please send an email to the CUPSCon Secretariat at cupscon@up.edu.ph. Certificates of participation will be sent via email to all the participants after the conference. Pictures of the plenary and parallel sessions will be shared in the Facebook page and Twitter of UP Padayon Public Service at facebook.com/UP Public Service and twitter.com/UP Public Service. They will also be shared on our website at publicservice.up.edu.ph/CUPSCon4. And now, to inspire us all with the message to continue doing the work of public service amidst the global pandemic, please join me in welcoming once again our beloved Director of the UP Padayon Public Service Office, Dr. Jeanette L. Yasol Naval.
As we close this two-day conference, I guess it is just appropriate that we all celebrate public service and the selfless and compassionate people who choose to serve in various modalities. You represent what is good and decent in this crazy, peculiar, maybe a better way of putting it, or let's just say, especially challenging period in our history. And we thank you. We thank us. While CUPSCon has always been engaging, this year's conference has been the most inspiring and heartening of all the CUPSCons. Despite its virtual mode, which oftentimes we see as a very impersonal way of engaging with our colleagues and friends, our shared interests to provide assistance and encouragement in this crucial time of need when life has been too challenging for our families, communities, and nation. Our desire to serve and to give has filled in the gap of the virtual space. Well, here are some bits and pieces of takeaways from the 24 panel sessions, which I was able to pick up when I was doing the session hopping during this two-day conference. I attended most of the sessions, and here are some memorable lines, statements by our public service practitioners that I've heard from their discussions. So one, they said in one of the panel sessions, in the time of a pandemic, we must always be sensitive to whatever other people are going through, because everyone has different ways of coping and threshold levels differ. I guess in a similar panel, they said there is no one size fits all solution to problems pertaining to mental health. With the innovations in the delivery of mental health and psychosocial support services due to the pandemic, the transition to the new normal of counseling and provision of mental health support will be more convenient, accessible, and hopefully more effective. Well, this may be because of the experience of being able to deliver it during the pandemic. In another panel, the panel which I think was very specialized, that there were only a few participants, not the usual 50 and 40 or 60, but there's a relatively small number of participants in this particular panel. But despite the small number of participants, because as I've said, this is a specialized panel, so much has been said about the nursing education, which was the main topic of that particular session. And they said, in nursing education, Collaborations between hospitals and nursing schools can contribute to the improvement of nursing education curriculum in this time of pandemic. I could still recall how active the presenters were in, sharing with one another their respective experiences in nursing education. Okay. Also, in another panel, I heard one saying the adaptation of service learning to a remote setup without sacrificing its very core is one thing, but ensuring that the students are even able to access their lessons and are hence able to appreciate the values learned from service learning is another. Access of students to their classes should still be a top-notch priority. Consulting and engaging with communities for CWTS delivery, despite the pandemic, is still possible, said in one panel. It even facilitated the exposure of students in distant communities, even if it is only virtual. And in another one, they said, ensuring access to correct information should be the topmost priority because it helps not only regular citizens, but also government units to make better and more informed choices and to ensure compliance. One thing that the public service initiatives we believe have accomplished. And another message has been sent in another panel. And they said, laymanized information for better understanding. Ang pagsusulong ng papel ng wika bilang paraan ng public service, tulad ng pagsasalin sa iba't ibang wika sa bansa ng mga terminolohiya o salitang may kaugnayan sa pandemya at COVID-19, upang mas lubos na maunawaan kung ano ang ating kinakaharap ng suliranin. Ang ganda po. Then, in another one, they said accessibility to information should not be synonymous with being able to disseminate it across channels, but it should also be inclusive. And there were wonderful narratives of community service by the different UP constituent universities and SUCs and other HEIs on how they were able to provide huge support with very limited resources and capacities in partnership with able communities, volunteers, and LGUs. These were very moving narratives that I've heard being shared in the session. Technical assistance should always be geared towards capacitating local government units so they may be able to develop their own means to gather data for better and more informed policy development and implementation. And another one says, public service reminds us that the academe cannot afford to be an ivory tower or an echo chamber. And I guess the discussion where we have the group of philosophy professors espousing the use of COI or community inquiry as part of the department's extension program. So I guess that's part of it. There was a special discussion on assisting and accommodating students with special needs, especially during the pandemic, and the opportunity to engage with their co-presenters who offer some help by providing materials. So I can very well see here that CUPSCon is succeeding in its attempt to put together all these practitioners so that they could help one another in the delivery of public service. The pandemic has made possible some small business ideas, which I was touched on, by schools for the out-of-school youth, like the modules on board waste pickup disposal social enterprise, among others. And another session, actually, there are a number of panel sessions that tackle this one, creative work as public service and public service as creative work. We artists have a lot to do in delivering public service. Radio, film, guitar at awit. I've heard very moving extension projects that really touch the lives of those who participated in these artistic endeavors. And also, I've heard the beautiful souls of our alumni overseas who have never forgotten to give back to our local communities in the country. And most of all, the ethos of community pantries, highlighting the values of bayanihan, pagkalinga, pag-agapay, sense of discipline, paying it forward, and to give until it hurts. UP Padayon shall ponder on how this conference unfolded during these past 2 days, including the discourses that we have created in the panel sessions as part of our post-event assessment. And it looks like what we shall see are public service initiatives, big and small, that are geared towards fulfilling not just the mandate of our universities or what is constitutional, but a sincere fulfillment of our primary moral duty to allow the flourishing of humanity. With this in mind, the UP Padayon team will be signing off from CUPSCon 4, having fulfilled our mission to bring all of you together so we may provide hope, inspiration, and encouragement to one another to continue engaging and in providing crucial and relevant public service. And I'm reminded of Nelson Mandela when he said, whether you change the linen or stitch up wounds, cook the food or dispense the medicines, it is in your hands to help build a public service worthy of all those who gave their lives for the dream of democracy. And in a more general sense, I say, for the dream of a flourishing humanity. At this point, I would like to recognize the contribution of our presenters who came from 70 SUCs, 27 private higher education institutions, 5 government agencies, 2 NGOs, and 2 from the industry. We have reached around 600 participants attending the conference at different times. And special mention to our students from MSU, from OLFU, and from the UP College of Medicine, who also took part in our productive exchange. We hope to be able to stage a similar conference to convene students in public service. Of course, to some of our presenters and members of the System Committee on Public Service, Monitoring and Reporting, who answered the heed of our moderators to be our moderators in the panel sessions, thank you. Our appreciation as well to the ITDC with Gabriel Villarente and to the Media Public Relations Office with AVP Wendell Capili. But most of all, the organizing team of UP Padayon who have worked so hard to help all of us stage this conference. So UP Padayon team composed of Jeremy Mimi Barreto, who heads this project, Charlie Ramos, the voiceover, and the one who is with us during the plenary sessions for the open forum, Eric Aguilar, for your interactive book of abstracts, Jessica Claridad, Mariel Antonio, Kyle Buensuceso, our secretariat in the sessions, Reggie Sarmiento, Reggie Reyes, our OBS people, and AJ Belen. On behalf of VP Elena Pernia and the team, I now formally close CUPSCon 4 until the next CUPSCon. Thank you everyone for participating. Padayon.
Thank you everyone for attending the 4th Colleges and Universities Public Service Conference. We hope that you will carry everything that you have learned here, including the networks that you may have formed with your fellow participants and colleagues, in your future public service and extension programs and engagements with your partners. Please keep your emails open for further advisories from the CUPSCon Secretariat. I am Charles Ramos, your voice-over for the conference, saying, till we meet again, Padayon!